Lucas gripped the mop handle tighter as laughter echoed down the spotless hallway of Westside Medical Center. 6 hours into his first day as a janitor, and his arms already felt like lead. "Hey, look at our newest medical professional," a tall man in blue scrubs called out. 3 other surgeons turned to look at Lucas, smirks spreading across their faces. At 17, Lucas was used to being invisible, not a target. He kept his eyes down, focusing on the floor. "I hear he told Diane in HR he wants to be a doctor. Someday," the tallest surgeon continued. "Isn't that precious? Maybe he thinks cleaning up after us is the first step to medical school." More laughter erupted. His threadbare uniform hung loosely on his thin frame, a stark contrast to their pressed scrubs and confident postures. "I think it's more likely he'll be pushing that mop when my kids are running this place," another added. Lucas felt heat rising. To his face, he'd taken this job because his mother's medical bills were piling up. His dreams of medical school seemed more distant with each bill that arrived. "Maybe we should quiz him," suggested a third surgeon. "See if he knows the difference between a scalpel and a spatula." As the surgeons continued their taunting, Lucas noticed a figure at the end of the hallway. A woman in a wheelchair sat silently, observing the scene, her steely gaze fixed on the group. Despite the wheelchair, she sat with the posture of someone used to being in charge. "I bet he can't even name the bones in the human hand," one jeered. "Hey, mop boy, want to take a quiz? First question?" "Perhaps," a clear, authoritative voice cut through the hallway. "You gentlemen would prefer to take that quiz yourselves. Under my supervision, of course." The laughter stopped instantly. The woman in the wheelchair had moved closer, her eyes sharp as she regarded the now silent group. Lucas stood frozen as tension filled the air. The woman's gaze shifted briefly to him, and for a moment he thought he saw something beyond sympathy in her eyes, something like recognition. "Dr. Amber Suarez," one of them muttered, voice stripped of confidence. Lucas's eyes widened. He'd heard that name before. Dr. Amber Suarez had been the country's most renowned neurosurgeon before her accident. "Dr. Evans," Amber addressed the tallest surgeon. "Do you recall your first day here? You dropped an entire tray of instruments during your first procedure." Dr. Evans's face flushed red. "Dr. Suarez, we were just—" "And Dr. Patel," she continued. "Wasn't your father a maintenance worker at Memorial? He worked 2 jobs to put you through medical school, didn't he?" Silence filled the hallway. Lucas stood still, hardly daring to breathe. "The measure of a physician isn't in their ability to belittle others," Amber said. "It's in their capacity for compassion and their willingness to see potential where others might not." She turned toward Lucas. "Young man, might I have a word with you in private?" Lucas nodded. The surgeons parted like the Red Sea as Amber wheeled past them. "Dr. Bennett, I believe you have patients waiting," she called over her shoulder. "And Dr. Evans, the board meeting minutes still haven't been submitted. I'd attend to that if I were you." Inside her office, bookshelves lined the walls from floor to ceiling, filled with medical texts. "Close the door, please," Amber said. Wheeling around to face him, her eyes studied him with intensity. "Do you know who I am?" she asked. "Yes, ma'am," Lucas replied. "You're Dr. Amber Suarez. You developed the Suarez method for treating inoperable brain tumors." A hint of a smile touched Amber's lips. "So you do read more than cleaning solution labels." "I read everything I can about medicine," Lucas admitted, "when I'm not working or taking care of my mom." Amber nodded slowly. "Those men out there, they were just like you once. Everyone starts somewhere." She paused. "But not everyone has the hunger I see in your—" Lucas felt something shift in the air between them. "Tell me," Amber said, leaning forward, "if circumstances were different, what would you be doing right now?" Lucas hesitated only briefly. "I'd be in college, studying pre-med. I'd be working toward becoming a doctor who never forgets what it feels like to be on the other side of the stethoscope." Amber's eyes lit up. "Interesting. I think we should talk about that at length." Amber's office felt worlds away from the sterile hallways where Lucas had been mopping. A photograph on her desk showed a younger Amber in surgical scrubs. standing tall, no wheelchair in sight. "Your mother is ill," Amber stated. Lucas nodded. "Cancer, stage 3. The treatments are expensive. And you dropped out of school to support her." Another nod. "What were your grades like?" "Straight A's in science and math. I was valedictorian before I had to leave," Lucas answered. Amber wheeled to a filing cabinet and pulled out a folder. "Your high school records are impressive. Perfect score on your biology AP exam. Science fair winner 3 years running." She looked up. "You're wasted pushing a mop, Lucas." "I don't have much choice," he replied defensively. "Everyone has choices," Amber countered. "I'd like to expand yours." She wheeled back to face him. "I'm still a consultant here. After my accident, I couldn't operate anymore, but my mind works fine. The board keeps me on as an advisor." Lucas listened intently, trying to understand where this was going. "I'm proposing an arrangement," Amber continued. "You'll continue working as a janitor. You need the income, and frankly, it provides excellent cover. But during breaks and for 2 hours after your shift, you'll meet with me. I'll teach you, train you." Lucas's heart raced. "Train me? For what?" "For medical school, of course," Amber replied. "Consider it an informal pre-med education. I have connections at 3 universities with excellent medical programs. When the time comes, if you've proven yourself, I'll make some calls." "Why would you do this for me?" Lucas asked, suspicious. Amber was quiet for a moment, her eyes drifting to the photograph. "Because I recognize something in you," she finally said. "The same fire I had at your age. Because talent shouldn't be wasted due to circumstance." She paused. "And because those pompous surgeons need a reminder that greatness can come from anywhere." "There's one condition," Amber added. "This arrangement stays between us, no one can know." "So I'd still be just the janitor to everyone else," Lucas clarified. "For now," Amber nodded, a glint in her eye. "But we'll know differently." Lucas extended his hand. "I accept." 3 months passed in a blur. Lucas's days fell into an exhausting but exhilarating routine. From 5 a.m. to 1 p.m. he was invisible, just another figure in gray scrubs pushing a mop. But during his breaks and after his shift, he transformed into a student of medicine under one of the most brilliant minds in neurosurgery. Amber was a demanding teacher, assigning textbook chapters that would make medical students sweat and quizzing him relentlessly. But she also opened worlds to him that he'd only glimpsed in books, showing him 3D models of the brain and walking him through complex case studies. "What would you prescribe for this patient?" Amber asked one afternoon. Lucas studied the symptoms thoughtfully. "It looks like temporal lobe epilepsy, but the EEG results don't match the typical pattern." He tapped his pen against his chin. "I'd want to rule out autoimmune encephalitis before starting anti-seizure medications." Amber nodded, a rare smile crossing her face. "Exactly what I recommended." The neurologist disagreed. 3 weeks later, blood tests confirmed autoimmune markers. The surgeons who had mocked Lucas now barely acknowledged his existence, which suited him fine. Dr. Evans occasionally created messes for Lucas to clean, but the petty behavior only strengthened his resolve. At home, Lucas's mother noticed changes in him. "You seem different lately," she said one evening as he helped change her IV. The at-home treatments had been Amber's suggestion. "Different how?" Lucas asked, adjusting the drip rate. "Happier, more focused." She studied his face. "And you're handling that IV like you've been doing it for years." Lucas shrugged, just watching the nurses closely. He hated lying to his mother, but Amber had been adamant about secrecy. "The moment people know you're my protege, everything changes," she'd warned. The double life took its toll. Lucas slept 4 hours most nights. Dark circles formed under his eyes, and he lost weight. But each time exhaustion threatened to overwhelm him, he pushed through. One day, cleaning the emergency room, Lucas overheard nurses discussing a patient whose symptoms didn't respond to treatment. He recognized the pattern from his studies with Amber and wanted to suggest they check for Wilson's disease. But he bit his tongue. He was just the janitor. That night he couldn't sleep, wondering if the patient would get the correct diagnosis. For the first time, the weight of his knowledge pressed on him, knowing something that could help but being unable to use it. "This is the hardest part," Amber told him later. "Carrying knowledge you can't yet apply. But your time will come." Lucas. 6 months into their secret arrangement, Lucas could recite the 12 cranial nerves in his sleep and discuss complex pharmacology with surprising sophistication. That Tuesday started like any other, until a commotion erupted at the front entrance. "Help, somebody help us." A man burst through the doors, supporting a woman whose face was alarmingly swollen, her breathing labored. "Sir, this is a specialty clinic. The emergency room is 3 blocks, the receptionist began. "No time," the man interrupted. "She's allergic to bees. Got stung in the park, she can't breathe." Lucas froze, recognizing anaphylactic shock immediately. The woman's lips were turning blue. The receptionist called for a doctor, but Lucas knew all physicians were in a staff meeting. By the time anyone arrived, he made his decision in a split second. Dropping his mop, Lucas rushed to the emergency cabinet behind reception, the one Amber had shown him during their lessons. "What are you doing?" the receptionist gasped as Lucas punched in the code. Lucas grabbed the adult epinephrine kit and knelt beside the woman. "Ma'am, you're having a severe allergic reaction," he said calmly. "I need to give you epinephrine. Are you allergic to any medications?" The woman shook her head, gasping. Lucas administered the epinephrine into her outer thigh, counting to 10 before removing the injector. "Lay her flat. Elevate her legs," he instructed the husband. "This should open her airways." Within moments, the woman's breathing eased. Color returned to her lips. Before Lucas could explain further, Dr. Evans rounded the corner, responding to the emergency call. He stopped short, eyes narrowing at the scene. Lucas kneeling beside the patient, empty epinephrine injector in hand. "What the hell do you think you're doing?" Dr. Evans demanded. "She was in anaphylactic shock," Lucas explained. "No one was here and she couldn't breathe. You administered nothing." Dr. Evans cut him off. "You're a janitor, not a medical professional. You could have killed her." "But he saved her," the husband protested. "She couldn't breathe, and he knew exactly what to do." Dr. Evans ignored him, focusing on the patient while shooting venomous glances at Lucas. After the patient was stabilized and transferred to an emergency room, Dr. Evans cornered Lucas. "You're fired," he spat. "Practicing medicine without a license is illegal. I'll make sure you never work in healthcare again." "But the patient," Lucas began, "could have died because of your reckless behavior," Dr. Evans finished. "Board meeting. My office now." As Lucas followed Dr. Evans, his stomach twisted into knots. Everything he and Amber had built was crumbling. Worse, he'd lose his income, and with it his ability to care for his mother. Yet beneath the fear, a small flame of defiance burned. He knew he'd done the right thing. Lucas sat outside the boardroom, his hands clasped tightly to hide their trembling. Through the frosted glass, he could see silhouettes gesturing animatedly. Dr. Evans no doubt describing his dangerous actions. Inside, the atmosphere was frigid. 8 people sat around a large table, with Dr. Evans standing at one end, triumphant. Amber sat near the opposite end, expression unreadable. "Mr. Lucas," began the clinic's director, Dr. Howard. "Dr. Evans claims you administered medication despite having no qualifications. Do you deny this?" "No, sir," Lucas answered. "The patient was in anaphylactic shock. She would have died before help arrived." "And how exactly does a janitor know how to recognize anaphylactic shock or administer epinephrine?" Dr. Evans asked, sarcastically. Lucas hesitated, his eyes flicking to Amber, who gave an almost imperceptible nod. "I've been studying medicine in my spare time," he said carefully. Dr. Evans scoffed. "Reading WebMD doesn't qualify you to treat patients." "The husband called to thank us," a woman board member interjected. The ER doctor confirmed Lucas's actions saved her life. "That's beside the point," Dr. Evans snapped. "He got lucky. Next time he could kill someone." "I believe I can address that concern," Amber spoke up. As it happens, Lucas has been acting under my supervision. The room fell silent. For the past 6 months, I've been mentoring Lucas, Amber explained calmly. He has shown exceptional aptitude. With all due respect, Dr. Soares, Dr. Evans cut in, that doesn't give him the right to practice medicine without a license. True, Amber conceded. But Good Samaritan laws protect individuals who provide emergency assistance in good faith. Lucas acted to save a life when no medical professionals were present. The board members exchanged thoughtful glances. Even so, Dr. Howard said, this raises serious questions about appropriate boundaries. Indeed it does, Amber agreed, which is why I think it's time to clarify a few things. She slid a folder across the table to Dr. Howard. Dr. Howard opened, his expression shifting from confusion to shock. This can't be right. I assure you it is, Amber replied. As the documents show, I am not merely a consultant. I am the clinic's majority shareholder, operating under my maiden name, Westbrook, to avoid any appearance of favoritism when my son, Thomas, was appointed as a surgeon here 6 years ago. A collective gasp ran through the room. Dr. Evans visibly paled. Thomas died in the same accident that put me in this wheelchair, Amber continued, voice tight with emotion. But I maintained my ownership stake, choosing to work behind the scenes. She looked directly at Dr. Evans now. Thomas's position was subsequently filled by his colleague, you, Dr. Evans. My son spoke highly of your surgical skills, if not your character. Lucas sat perfectly still, processing this revelation. Amber wasn't just a respected former surgeon. She was the owner of the entire clinic. This changes nothing about the janitor's actions, Dr. Evans said, though his voice had lost its certainty. His name is Lucas, Amber corrected sharply, and it changes everything about how this board will address the situation. The boardroom remained silent as Amber's revelation sank in. Dr. Evans stood frozen, his mouth slightly open. To be clear, Amber continued, I'm not using my position to shield Lucas from consequences if he truly acted inappropriately. But I am insisting on a fair evaluation based on medical merit, not hospital hierarchy. Dr. Howard cleared his throat. Dr. Soares, or Westbrook, while this ownership revelation is surprising, we still have protocols. Unlicensed personnel cannot administer medical care. With respect, sir, Lucas spoke up. I didn't perform surgery or prescribe medication. I administered emergency first aid when no medical professionals were present, and a life was at stake. Dr. Evans found his voice again. This is ridiculous. He's a janitor playing doctor, and now he's lecturing the board about medical ethics. His sarcasm reignited something in Lucas. 6 months of being invisible, of swallowing his pride while Evans created messes for him to clean just for amusement. It had built up a reservoir of determination. Actually, Lucas said, standing up, I'd like to propose something. There's a patient in the neurology ward, bed 27, female, 10 years old. She's been here for 3 weeks with symptoms that have stumped everyone. Severe headaches, intermittent double vision, unexplained weight loss, and seizure-like episodes that don't register on EEG. The room went silent. Lucas could see surprise that he knew about this patient at all. I've observed doctors discussing her case, he explained, which was partially true. The rest had come from case files Amber had shared. I believe I know what's wrong with her. This is absurd, Dr. Evans sputtered. Now he's claiming he can solve a case that stumped our entire neurology department? Lucas faced the board directly. Test me. Let me review her case formally, with the full medical team present. If I'm wrong, I'll walk away from this clinic today. No argument. I'll disappear. And if you're right, Dr. Howard asked, then I keep my job, Lucas replied simply. And Dr. Evans acknowledges publicly that I acted appropriately in the anaphylaxis case. You can't seriously be considering, Dr. Evans began, but Amber cut him off. I think it's an excellent proposal, she said. A practical demonstration of knowledge rather than a theoretical debate about protocol. Dr. Howard leaned back, considering. The girl's parents are desperate for answers. We've consulted with 3 specialists already, with no consensus. He glanced at the other board members. I see no harm in allowing this, provided the regular medical team has final say on any treatment. This is highly irregular, protested another board member. So is finding out our consultant is actually the clinic's owner, Dr. Howard replied dryly. You have 1 hour to review her file, then you'll present your assessment to her medical team. Lucas nodded, his heart pounding, but his resolve firm. Fair. As the meeting adjourned, Amber wheeled beside Lucas. That was either incredibly brave or incredibly foolish, she murmured. You'd better be right about this. Dr. Evans brushed past them, leaning down to whisper, Enjoy your moment, janitor. When this is over, I'll personally escort you out the doors. Lucas watched him go. I need to see that file again. There was something about her cerebrospinal fluid analysis that's been bothering me. Amber nodded, pride breaking through her concern. Then let's get to work. The conference room buzzed with tension as Lucas stood before a whiteboard, surrounded by skeptical faces. Dr. Evans sat in the front row, arms crossed, a smirk playing at the corners of his mouth. The girl's primary physician, Dr. Patel, reviewed charts with a furrowed brow. For those who don't know me, Lucas began, I work as a janitor here, but I've been studying medicine independently. A few eye rolls greeted this statement. Sofia Martinez, age 10. Admitted 3 weeks ago with severe headaches, intermittent double vision, unexplained weight loss, and episodes resembling seizures that don't register on EEG. Lucas pointed to the brain scans. Her MRI shows no structural abnormalities. CT scan negative. EEG inconclusive. Blood work shows elevated inflammatory markers, but no clear pattern of infection. Lumbar puncture showed slightly elevated protein levels. You've ruled out the usual suspects, Lucas continued. Epilepsy, brain tumors, meningitis, encephalitis, autoimmune disorders. You've checked for toxins, vitamin deficiencies, and genetic disorders. Dr. Patel leaned forward. And your diagnosis is… Lucas took a deep breath. Anti-NMDA receptor encephalitis. A murmur ran through the room. Dr. Evans scoffed loudly. That's extremely rare in children her age, Dr. Patel objected. Rare, but not impossible, Lucas countered. And it explains the constellation of symptoms better than any other diagnosis. He turned to the whiteboard. The seizure-like episodes that don't register on EEG? Classic presentation? The psychiatric symptoms that appeared later? Mood swings? Confusion, personality changes. Consistent with anti-NMDA encephalitis. But we tested for autoimmune markers, a neurologist interjected. Yes, Lucas acknowledged, but the specific anti-NMDA antibody test wasn't included in that panel. He pointed to a note in the file. There's another clue. 3 months ago, Sophia had what was diagnosed as a viral rash. Certain viral infections can trigger the autoimmune response that leads to anti-NMDA receptor encephalitis. The room had gone quiet, initial skepticism giving way to consideration. Test her CSF specifically for NMDA receptor antibodies, Lucas said. If I'm right, you can start immunotherapy immediately. Corticosteroids, plasma exchange, possibly rituximab. Dr. Patel was nodding, making notes. It's a compelling theory. Unusual, but it fits better than anything we've considered. It's speculation from someone who mops floors. Dr. Evans cut in. Dr. Patel looked up. Actually, I think he might be onto something. We haven't specifically tested for anti-NMDA antibodies. I'd like to order that test immediately, she continued, standing, and revisit her history for other signs we might have missed. The meeting broke up with doctors discussing Lucas's theory, some skeptical but intrigued. Dr. Evans stormed out without a word, face flushed with anger. Lucas remained by the whiteboard, heart pounding. He'd made it through the presentation, but the real test would be the results. The next 48 hours crawled by. Lucas continued his janitorial duties, aware of the whispers following him, through the hallways. When the results finally came in, Dr. Howard sought out Lucas, finding him cleaning a bathroom. The test was positive, he said without preamble. Anti-NMDA receptor antibodies confirmed. Treatment has already begun, and Sophia is responding well. He extended his hand. Remarkable diagnostic work. Lucas gripped the offered hand, relief washing over him. Thank you, sir. I believe this means you keep your position here, Doctor, Howard continued. Though I suspect your days of pushing a mop may be numbered. Word of Lucas's diagnostic triumph spread through the clinic like wildfire. Staff who had barely noticed him before now nodded in recognition. Dr. Patel had even invited him to observe Sophia's treatment plan discussions. A week after the diagnosis, Amber summoned Lucas to her office. When he arrived, she was staring out the window, her back to the door. "Close it," she said without turning around. Something in her voice made Lucas tense. This wasn't their usual meeting. He shut the door and waited. The office felt different, charged with an energy he couldn't identify. "You exceeded all my expectations with Sophia's case," Amber finally said, wheeling around to face him. "You showed not just knowledge, but clinical intuition." "Thank you," Lucas replied, uncertain where this was heading. "I couldn't have done it without your training." Amber shook her head. "You had the raw talent, I merely helped shape it." She paused, fingers tapping nervously on her armrest, a gesture he'd never seen from her before. "There's something I need to tell you, Lucas. Something I should have told you from the beginning." She removed an old folder from her desk drawer. "Do you know why I chose you? Out of all the staff here, why I singled you out that day?" Lucas shook his head. "I assumed it was because you saw potential." "It was neither," Amber said, opening the folder. 6 months before I approached you, I received documents from my late son's safety deposit box. Thomas had arranged for them to be delivered 5 years after his death." She handed Lucas a photograph of a younger version of her son standing next to a beautiful young woman. "This is Thomas and his girlfriend Sarah," Amber explained. "They dated during his residency. Thomas was preparing to propose when she discovered she was pregnant." Lucas studied the photograph, unease building in his stomach. "Before Thomas could propose, Sarah disappeared," Amber continued. "Left without a word. He searched for months, but never found her. 5 years later, he died in the accident that put me in this chair." She handed Lucas another photo, a baby in a hospital bassinet. Even from a distance, Lucas could make out the name, Lucas. His hands began to tremble. "What are you saying?" "Sarah didn't want a doctor's wife's life," Amber said softly. "She wanted freedom, a different future. But she had the baby, you, before moving across the country. Thomas never knew." Lucas stared at the photograph, his world tilting. "How can you be sure?" "DNA test," Amber replied simply. "A strand of hair from your comb in the employee locker room was all it took." She met his eyes directly. "You're my grandson, Lucas." The room seemed to spin. Lucas gripped the desk edge. "All this time, the job offer, the lessons, it wasn't about my potential at all." "It was always about your potential," Amber corrected firmly. "But yes, I orchestrated your employment here. I wanted to know you, to see what kind of man my grandson had become." "And you didn't think to tell me?" Lucas's voice rose, anger breaking through shock. "You've been lying to me for 6 months." "I needed to be sure," Amber replied, her calm exterior cracking. "Sure that you were worthy of Thomas's legacy. Sure that you had his gifts." "So it was a test," Lucas said bitterly. "Everything, a test to see if I measured up to your dead son?" "No," Amber shook her head vehemently. "It began that way, perhaps. But Lucas, you exceeded every expectation. You're not just Thomas's son, you're your own person, with abilities that might one day surpass even his." Lucas stood abruptly, still holding the photographs. "Does my mother know? About you, about Thomas?" "I don't believe so," Amber said quietly. "From what I've gathered, she never told anyone who your father was." "I need to go," Lucas said, his voice hollow. "I need time to process this." Amber nodded, eyes bright with unshed tears. "Whatever you're feeling, please know that everything I've done It wasn't just because you're Thomas's son. It was because I saw the same brilliance in you that I saw in him." Lucas paused at the door, 1,000 questions battling in his mind. But one rose above the others. "Why now?" he asked. "Why tell me today?" "Because after what you did for Sophia," Amber replied, "I couldn't bear the deception any longer. You deserve to know the truth, all of it." For 3 days, Lucas avoided the clinic. He called in sick and spent hours walking the city streets, trying to make sense of Amber's revelation. On the 4th day, he found himself outside Amber's apartment building. Part of him wanted to walk away, but a stronger part needed answers. Amber answered the door in her wheelchair, her face lighting up briefly before settling into careful neutrality. "Lucas, I wasn't sure I'd see you again." "Neither was I," he admitted, stepping inside. Her apartment walls were lined with medical books, diplomas, and photographs. He found himself searching the faces for resemblances to his own. "Why didn't you tell me from the beginning?" he asked. "Why the elaborate setup?" Amber wheeled to the window, gathering her thoughts. "Fear primarily," she finally said. "Fear that you'd reject me, that you wouldn't believe me, or that you'd only be interested in my connections or money." "That's not fair," Lucas protested. "You didn't even know me." "No, it wasn't fair," Amber agreed. "But I'd spent 17 years not knowing you existed. I convinced myself that this roundabout approach was more prudent. So all this time you were testing me?" The hurt in Lucas's voice was palpable. "At first," Amber admitted. "But that changed quickly. Your dedication, your mind, your compassion. Those qualities stand on their own, regardless of your parentage." Lucas absorbed this, some anger beginning to dissipate. "Tell me about him, about my father." For the next hour, Amber shared stories of Thomas, his childhood obsession with taking apart electronic devices, his struggle with organic chemistry in college, his gentle way with frightened children. As she spoke, Lucas caught glimpses of himself in the descriptions. "He would have been so proud of you," Amber said, voice thick with emotion, "especially of what you did for Sophia." "I wish I'd known him," Lucas said quietly. "So do I." Amber reached for a photo album. "These might help you know him better." As they paged through photos, a question that had been nagging at Lucas surfaced. "Why did you wait until I was 17? If you've known about me since Thomas's letter." Amber closed the album slowly. "Because I respected Sarah's choice, even if I didn't understand it. She clearly didn't want Thomas or his family in your life. I told myself I would stay away until you were an adult." "Does Dr. Evans know?" Lucas asked suddenly. "That I'm Thomas's son?" "No," Amber shook her head. "No one does. Evans was Thomas's colleague and friend, but Thomas never told him about Sarah. As far as Evans knows, I'm just an eccentric former surgeon with a soft spot for an unusually bright janitor." Lucas absorbed this, a new understanding coming into focus. It must have been difficult watching Evans take over Thomas's position. "More than you know," Amber admitted. "Evans was talented but always in Thomas's shadow. After the accident, he finally had what he'd always wanted. If he knew you were Thomas's son, he'd feel threatened all over again," Lucas finished, "by a teenage janitor no less." A ghost of a smile touched Amber's lips. "Precisely. I'm still angry you didn't tell me sooner," Lucas finally said. "I had a right to know who my father was." "You did," Amber agreed. "I made a mistake in waiting. I can only ask for your forgiveness and the chance to be part of your life now, not just as your teacher, but as your family." Lucas looked around. The apartment, at the medical texts he'd studied, at the photos of the father he'd never known, at the woman who had recognized his potential. "I need time," he said honestly, "but I don't want to stop our lessons, and I'm not ready to tell my mom yet. This would be a lot for her to process." Amber nodded. "We'll move forward at your pace. No more secrets, no more tests." As Lucas rose to leave, he paused. "One more question. When you saw those surgeons mocking me that first day, did you intervene because I was your grandson, or would you have done the same for anyone? Amber considered carefully. I'd like to believe I would have intervened regardless, but knowing you were Thomas's son, it made it personal. Lucas nodded, appreciating her honesty. I'll see you tomorrow then for our regular lesson. Tomorrow, Amber agreed, relief evident in her voice. 2 years passed. Lucas, now 19, moved confidently through the corridors of Westside Medical Center, not as a janitor but as a medical assistant and student. After Sophia's case, Dr. Howard had created a special position for him, allowing Lucas to work at the clinic while taking pre-med courses, fully funded by an anonymous donor program everyone knew was Amber's doing. The clinic itself had transformed. Following the revelation of Amber's ownership, she had taken a more active role in governance, implementing changes that emphasized compassionate care alongside medical excellence. Scholarship program for promising students from disadvantaged backgrounds, inspired by Lucas's journey, was now in its second year. Even Dr. Evans had evolved, though not without resistance. After Lucas's diagnosis proved correct, Evans had been forced to publicly acknowledge his skills. The humbling experience had gradually tempered his arrogance. While he and Lucas would never be friends, a grudging professional respect had replaced the open hostility. On this particular morning, Lucas stood beside Dr. Patel in examination room 3, presenting the case of a patient with persistent migraines. The pattern suggests cluster headaches rather than classic migraines, Lucas explained. The timing, duration, and the pain being centered around one eye are all consistent with clusters. Dr. Patel nodded approvingly. Excellent differential. Diagnosis. What treatment would you recommend? As they discussed options, Lucas caught a glimpse of his reflection. No longer the uncertain teenager in a janitor's uniform, but a confident young medical professional. The transformation still surprised him sometimes. After the consultation, Lucas headed to Amber's office for their weekly meeting. Though many now knew of their family connection, they kept that aspect of their relationship private at work. Results from the clinical trial came in, she announced as he entered. The neuroregeneration therapy shows promise. Lucas felt hope surge. The experimental treatment might help reverse some of Amber's spinal cord damage. It was still years from widespread approval, but Amber had been accepted into an early trial. Their conversation shifted to medical cases, then to Lucas's upcoming MCAT preparation. As always, Amber pushed him to think deeper, to consider angles others might miss. As they discussed expanding the scholarship program, a commotion in the hallway caught their attention. Through the open door, Lucas could see a young man in a maintenance uniform being berated by a visiting surgeon, almost a mirror of his own experience 2 years earlier. Without hesitation, Lucas stepped into the hallway. Is there a problem here? The surgeon looked annoyed at the interruption. Just explaining to the cleaning staff that medical equipment needs special handling. He nearly knocked over an expensive machine. The maintenance worker stared at the floor, face flushed with embarrassment. I'm sure there's a way to communicate that without public humiliation, Lucas replied calmly. The surgeon's eyes narrowed. And you are? Lucas, medical associate and student doctor under Dr. Soares. He extended his hand to the maintenance worker. I'm Lucas. You're new here, right? The young man nodded. Carlos, started last week. Welcome to Westside, Lucas said warmly. It's a great place to work and to learn. He turned back to the surgeon. We value all our staff here regardless of their role. The surgeon muttered something about checking on his patient and walked away. Don't worry about him, Lucas told Carlos. If you're interested in learning more about the medical equipment, I'd be happy to show you sometime. I started as a janitor here myself. Carlos's eyes widened. Seriously? And now you're in medical training? It's a long story, Lucas smiled. But this place has a way of recognizing potential where others might miss it. As Carlos continued his rounds with renewed confidence, Lucas turned to find Amber watching from her doorway, pride evident in her expression. That, she said quietly, was pure Thomas. He never could stand by when someone was being mistreated. Lucas felt warmth spread through his chest at the comparison. Over the past 2 years, he'd come to know his father through Amber's stories and old journals. Each connection to Thomas felt like recovering a piece of his own identity. Maybe, Lucas acknowledged, but it was also pure Amber. You taught me that first day that everyone deserves respect, regardless of their position. As they watched, Carlos continue his work with renewed dignity. Lucas knew that this, even more than the diagnoses or medical breakthroughs, was the legacy he wanted to build. A place where talent was recognized regardless of title, where compassion mattered as much as competence, and where the most unlikely beginnings could lead to extraordinary futures.
Have you ever been underestimated because of your job, your age, or your appearance? Or have you caught yourself making assumptions about someone based on their position? Perhaps the most powerful message in Lucas's story is that true mentorship isn't just about teaching skills, it's about seeing potential in others that they might not even see in themselves. What difference could you make in someone else's life by simply taking the time to recognize their potential and offering them guidance, as Amber did for Lucas? Share your thoughts in the comments below, and remember to subscribe for more stories that explore the extraordinary moments that transform ordinary lives.